Hello, my name is Jacob Farrell. This will be my full head-to-toe assessment submitted to the West Virginia University at Parkersburg Nursing 320 class. We'll begin. Patient is sitting upright in chair, appears to be dressed appropriately for the weather, appears for stated age, is well nourished. We'll begin with your head. So head is normal cephalic. We'll go ahead and finish first. Any pain or tenderness?
No.
No pain or tenderness noted upon palpation. Scalp is intact. No masses, no lesions. Skin is pink, warm, and dry. No obvious infestations. First thing I want to have you do is close your eyes. And every time when you use a Q-tip, and every time that I touch your face, I want you to tell me now.
Now. Now. Now. Now. Now. Now.
Next thing that we're going to have you do is I want you to smile, frown, puff your cheeks, and blow the air out. Good. Cranial nerves 5 and 7 are intact. Next thing I'm going to do is palpate your sinuses, beginning at the frontal and maxillary. Any pain or tenderness?
No.
No pain or tenderness noted. Go ahead and palpate the temporal arteries. And they're 2+ bilaterally. Go feel the temporomandibular joint and open your mouth. Close your mouth. Any pain or tenderness?
No.
No pain or tenderness noted. No crepitus noted. Next thing I'm going to do is I'm going to palpate your lymph nodes. I want you to tell me if there is any pain or tenderness.
No.
Any pain or tenderness here?
No.
Lymph nodes are non-palpable. No pain, no tenderness noted as well. We'll go ahead and move to your eyes. So the first thing I'm going to do, I'm going to grab the Snellen eye chart and we'll begin the examination. In the office, the nurse should be positioned 20 feet from the patient. Then we'll begin the exam. So go ahead and cover your left eye. We'll be testing the right eye here. Go ahead and read the smallest line that you can.
EDFCZP.
And the right eye vision is 20/30. Go ahead and cover your right eye and test the left.
EDFCZP.
And vision is 20/30 in the left eye as well. Next thing I'm going to have you do is I'm going to have you follow my pen light with your eyes, keeping your head still. Okay. Nice stuff. Good. All right. Cardinal gazes are intact. No nystagmus noted. Pupils appear to be a 5 bilaterally and constrict to 3 millimeters bilaterally. Next thing I'm going to have you do is I want you to follow my pen light in towards your nose. Good. Pupils are equal, round, reactive to light and accommodation. Cranial nerves 2, 3, 4, and 6 are all intact. I'm going to go ahead and look at your conjunctiva. They're pink and moist. Sclera is white. No obvious discharge from the eyes. Alright, we're going to move to your ears next. Any pain or tenderness?
No.
No pain or tenderness noted. Skin is intact. It's pink, warm, and dry bilaterally. No discharge noted bilaterally. We're going to go ahead and test cranial nerve 8. So I want you to cover one of your ears for me. I'm going to whisper something. Repeat it back.
1, 2, 3.
We'll do the next side.
ABC.
Good. Cranial nerve 8 is intact. We'll move to the nose next. Nose appears midline. Any pain or tenderness upon palpation?
No.
Okay, go ahead and tilt your nose back for me. Nasal mucosa is pink and moist bilaterally. No discharge and no bleeding noted. Go ahead and cover one side of your nose for me. Breathe in and out. And we'll do the opposite side. In. Good. Nares are patent bilaterally. We're going to have you close your eyes for me. And I'm going to have you identify this smell for me.
Orange.
Good. Cranial nerve 1 is intact. Move to your mouth and throat next. Lips are pink, moist, no cracking, no bleeding noted. Go ahead and open your mouth for me. Uvula is midline, rises and falls, say ah.
Ah.
Tonsils are absent, Mucosa is pink, moist, hard and soft palates are intact. Teeth are intact with no obvious caries. Go ahead and close your mouth for me. Next thing I'm going to have you do, I want you to close your eyes for me. I'm going to put something in your hand. I want to have you taste this. I want you to tell me what taste you.
Salty.
Good. Cranial nerves 5 and 7 are intact. 2, 3, 4, and 6 are intact. And then cranial nerves 9, 10, and 12 are intact as well. Alright, next thing that we're going to do is we're going to move to your neck. Neck appears midline. We'll go ahead and palpate your carotid arteries. And they're 2+ bilaterally. I'm going to listen for bruise. Okay, tilt your head back in and hold your breath. Good. No bruise noted. Alright, next thing that we're going to do is I'm going to go to the back. I'm going to palpate your thyroid gland. So tilt your head forward to the right. Good. And swallow. Good. Any pain or tenderness?
No.
No pain or tenderness noted. Thyroid gland is non-palpable. No obvious mass is noted. Next thing I'm going to have you do is tilt your head back. I'm going to feel your trachea. Swallow. Good. Trachea is midline. No pain or tenderness noted. We'll test the range of motion in your neck. So go ahead and lean your head forward and backwards, to the right, to the left. Good. Circle to the right and to the left. Good. Patient has full range of motion to the neck. Any pain or tenderness noted?
No.
Good. All right, next thing we'll do is we'll move to your upper extremities. So we'll go ahead and feel your shoulders first. Go ahead and shrug your shoulders for me, please. Good. Cranial nerve 11 is intact. Next thing that we're going to do is evaluate your upper extremities. Hair is distributed evenly. Skin is pink, warm, and dry. No obvious masses, no lesions. Radial pulses are 2+ bilaterally. Skin turgor is elastic bilaterally. Capillary refill is less than 2 seconds bilaterally. Good. I want you to take and grip my hands. Good. Now pull me towards you. Push me away. Good. Muscle strength is normal in the upper extremities bilaterally. There seems to be no deficit thus far. Go ahead and test the range of motion in your upper extremities. So go ahead and place your arms above you and put them down. Okay. Now put them out beside of you. Put them back. Move them forward. Good. Now put them out beside of you again. Circles forward and backwards. Good. Any pain or tenderness?
No.
Patient has full range of motion in the shoulders bilaterally. Go ahead and move your elbows up and flex down. Good. Any pain or tenderness?
No.
Full range of motion in the elbows. Go ahead and move your wrists up, down, in, and out. Any pain or tenderness?
No.
Good. Full range of motion in the wrists bilaterally. Go ahead and move all your fingers for me. Good. Any pain or tenderness?
No.
Good. Full range of motion in the hands and fingers bilaterally as well. Next thing I want to do is I want to move to your chest. Respirations are even, non-labored. Chest rise is equal and symmetrical bilaterally. We'll go ahead and first start by palpating for tactile fremitus. We'll touch your chest. Breathe in and out, in, out, in, out. Move to the back. In, out. Maybe move forward for me a little bit. Good. In, out, in, out, in, out, in, out. Good. No tactile fremitus noted posteriorly, anteriorly, or laterally. Next, we're going to palpate or percuss, excuse me. Move forward for me, please. Good, sit back for me. Resonance noted posteriorly, anteriorly, and laterally. Last thing I'm going to do is I'm going to listen to your lungs, beginning at the front, move to the back, and then to the sides. Good. I'm going to sit forward for me. In, out. In, out. In, out. In, out. In, out. Good. In, out. In, out. Good. Breath sounds are clear to auscultation bilaterally, posteriorly, anteriorly, and laterally. Next thing I'm going to have you do is I'll have you move to the couch. We'll lie down on the couch. We'll examine your heart, your abdomen, and your lower extremities. We'll first evaluate for jugular vein distension. I'll have you tilt your head back for me, please. Move to the right and to the left. Good. No JVD noted. We'll begin listening to the heart at the aortic, pulmonic, tricuspid, and mitral valves. Beginning at the aortic, to the pulmonic, and to the tricuspid, mitral, aortic, pulmonic, tricuspid, mitral. S1 and S2 noted at all valves. Alright, next thing I want to do is palpate the point of maximal impulse, which is located at the second intercostal space at the left mid-clavicular line. Palpate. The PMI is 2+. And at this point, the nurse will palpate for 60 seconds, with the normal heart rate being between 60 and 90 seconds. So next we'll move down to your abdomen. The abdomen is flat. We'll go ahead and listen first. No obvious masses or pulsations. And bowel sounds are active in all 4 quadrants. No bruit noted over the abdominal aorta. Next thing I'm going to do is I'm going to percuss your stomach. Good. Tympany noted in all 4 quadrants. Last thing I want to do is palpate your stomach, and I want you to tell me if there's any pain or tenderness.
No.
No pain or tenderness noted. Abdomen is soft and non-tender. Alright, now we'll move to your lower extremities. So I will begin by feeling the skin. Skin is intact. It's pink, warm, and dry. No masses, no lesions noted. Pedal pulses are 2+ bilaterally. Capillary refill is less than 2 seconds. Skin turgor is elastic. I'm going to use my pen light here. I'm going to test the plantar reflex. Good. And that's normal bilaterally. Next thing that we're going to do is I want you to flex your ankles up and then feet down. Good. Plantar flexion and dorsiflexion is normal bilaterally. Okay. And I'm going to have you take your left heel and move it down your right shin. Good. And then do the same on the opposite side. Good. Okay. And then I want you to go ahead and stand for me. Okay. I want you to take your left finger, bring it to my finger, and then to your nose. Good. And then same with the right, to your nose. Good. Cerebellar function is normal. All right, next thing that we're going to do is I'm going to go over here. Have you face me, and I want you to walk towards me. Turn around and walk back. patient ambulates with a steady and even gait, maintains balance well. We're going to have you close your eyes and put your arms right out in front of you. Good. Patient has a negative Romberg test. All right. Next thing that we're going to do is we're going to test the range of motion in all of your joints. So I want you to bend forward. I want you to bend backwards, to the left, to the right. Good. Any pain or tenderness?
No.
No pain or tenderness noted. Patient has full range of motion of the spine. Next thing I want you to do, I want you to bend over, touch your toes. Good. And then I want you to, good, like that. And then I want you to crouch down. Any pain or tenderness?
No.
Good. Patient has full range of motion of the knees. First thing I want you to do is go ahead and bring your left foot forward, backwards, to the left side, and in. Good. Same with the right, forward, backwards, out, and in. Good. Any pain or tenderness noted?
No.
Full range of motion of the hips as well. All right, go ahead and we assessed your foot. So go ahead and move your toes for me on each foot. Good. Patient has full range of motion of the toes on each foot. Last two things that we'll be doing, I want you to close your eyes for me. I want to put something in your hand and I want you to identify what the object is.
A key?
Yes, stereognosis is intact. Last thing that we're going to do, put your hand up for me. I want you to tell me what I'm drawing in your hand.
An 8.
Good. Graphesthesia is intact as well. This completes my head to toe assessment. Thank you.